Hi, welcome to Stay Healthy Expert Tip, Living with Diabetes. I'm Dhila, your Watsons Pharmacist. In today's episode, we have Dr. Shalini Sridharan, a consultant endocrinologist from Hospital Pantai, Kuala Lumpur. So, Doctor, what is the incidence rate of diabetes among Malaysians?
The incidence rate of type 2 diabetes among Malaysians is about 18.3%, and half of this, which is about 8.9% of the population who with diabetes, were not aware of the diagnosis.
Can diabetes be reversible?
Majority of them are symptom-free, and they probably found out just by a routine medical checkup. If they were routinely monitoring their blood sugar, and we could probably reverse it, but that involves intensive lifestyle and dietary intervention accompanied by a weight loss of at least 15% if the patient is overweight or obese.
Can diabetes run through family or genetically pass the disease to the family members?
Yes, it is. Definitely for type 2 diabetes, there is a genetic predisposition. In fact, it is a risk factor for them to develop the disease. If any of the family members lives with the disease, or if their parents or both, the chances can go as high as 70%.
What is the relationship or correlation between the weight and also diabetes?
Well, for the majority of type 2 diabetes, in fact about 70% of them are overweight and obese, because many of our patients actually struggle with weight loss as they are diagnosed. Insulin resistance tends to be more severe if the patient is obese.
What is the normal fasting and random blood sugar should be?
For fasting, that means after overnight sleep and the next morning, your blood glucose should not be more than 7 and it cannot be less than 4. And if you're talking about random or post-meal meaning 2 hours after a meal, we would like the sugar to be below 8.5. For people who are older and frail, the targets are higher. We do not want to aim a very strict level for them, because there is a risk of causing very low blood glucose level. We call it medically as hypoglycemia, which can be dangerous for them. It can also cause death. The younger ones we would like to target as normal as possible. The older ones we tend to relax a little bit.
If the patient is diagnosed with diabetes, should the patient on with insulin, and the treatment, will it be lifetime or just a short period?
So type 2 diabetes is a state of insulin resistant, meaning the body is not very sensitive to the effect of insulin in their body, and usually they require medication to help overcome this resistance. Whereas in type 1 diabetes, there is a state of complete insulin deficiency, meaning they need to be given insulin to help them cope with their high glucose level, and it may be for lifetime.
What are the consequences of the untreated diabetes?
So if the diabetes is left untreated for a long duration, this may cause the kidney to be damaged, nerve damage that can contribute to development of diabetic foot ulcer, which may end up with amputations. Other than that, heart attack and stroke. So what are the complications that diabetes bring to the eyes are cataract, glaucoma, and also diabetic retinopathy.
What are your key message to our audience?
Very simple message would be lifestyle intervention that involve regular exercise, limitations of sugary food, carbohydrate or calorie-dense food. Choose nutrient-dense food instead. If you are a smoker, try to quit smoking. Try to bring down the weight. As I've already mentioned, weight loss will probably be able to reverse diabetes.
Thank you so much, Dr. Shalini, for your insightful sharing. Well, as we know that diabetes cannot be cured, we can still live harmony with healthy lifestyle with diabetes. Stay tuned with us as we will bring more tips for living with diabetes. See ya!